مؤنس أكاديمي. أقدم هذا العمل خالص لوجه الله الكريم، آمل أن يكون عونا لشباب الأطباء ليقدموا خدمة عالية المستوى ترقى بمستوى الطبيب العربي وتخدم المجتمع بأمانة وإخلاص. Episode number 5 From Bedside to the Best Practice. Here is a 62 years old woman coming for initial screening colonoscopy. His past medical history is a menopausal hormonal therapy and hypothyroid, where he take levothyroxine. She is retired high school teacher, and he drink 1 glass of wine per day, and he smoked 20 pack of tobacco per year. No family history of colorectal cancer or bulbosis syndrome. Upper endoscopy evaluation while you are doing a colonoscopy. You found 25 polyps all over the colon, ranged from 4 mm to 8 mm, none of them in the rectum. All those polyps was removed by cold forceps or cold snare. And the pathology come back saying that it is a sessile serrated adenoma. So the question is, which is the following is a strong risk factor for her condition? Is it alcohol consumption or tobacco, or because it is a female, high risk for colorectal cancer, or the hypothyroid? The answer is depending on your diagnosis. As you diagnose this patient is serrated polyp or serrated bulbosis syndrome. If you diagnose as serrated polyp, so the smoking will be high risk factor. If you diagnosed as serrated bulbosis syndrome, so the smoking will be lowering risk factor, which is called smoking paradox. So this patient is meets the criteria for serrated bulbosis syndrome, which meets more than 3 polyps, any size through all over the colon, 5 of them in the proximal rectum, and we will discuss later in this lecture what is the criteria for serrated bulbosis syndrome. No relation between alcohol and gender and hypothyroid. What is serrated bulbosis syndrome؟ أول ما نقول serrated bulbosis syndrome يجي في مخك حاجتين: sawtooth appearance و surveillance. ليه colonoscopy surveillance؟ ليه؟ عشان this high risk patient. What is serrated bulbosis syndrome? Serrated bulbosis syndrome is a sawtoothed appearance of the crypts. architecture زي ما احنا شايفين هنا الكريبتس باينة على انها زي سنون المنشار. It is a rare heterogeneous. It's not linked to a single gene. Also, a raffin pathogenic variant are found in a small minority of patients. Why the serrated bulbosis syndrome is important? Because it carry high risk for colorectal cancer, between 7 to 70%, for including depending on the phenotype and surveillance. Also, puts the first degree relevant in high risk for serrated bulbosis syndrome and colorectal cancer. Also, it make a psychosocial burden in healthy anxiety and reduce quality of life. So, the serrated bulbosis syndrome present of multiple serrated polyp in the colon. This includes دخلت تحتها الhyperplastic polyp, sessile serrated polyp أو sessile serrated lesion, or traditional serrated adenoma. What is the WHA criteria for sessile serrated polyp syndrome. We have three criteria. First one saying that at least 5 serrated polyps, lesion or polyps in the proximal of the rectum, all of them more than 5 millimeter in diameter. At least two of them more than or equal to 10 millimeter in diameter. This is also it's including the hyperplastic polyp or sessile serrated lesion or sessile serrated polyps or traditional serrated adenoma. Criteria 2, any number of serrated polyps with positive family history of first degree relevant with sessile serrated polyp syndrome. Criteria 3, more than 3 serrated polyp any size with more than 5 proximal to the rectum. طب هنفتكر الكلام ده ازاي؟ نفتكره بالآتي. كريتيريا واحدة افتكر 5 5 10. 5 at least 5 polyps more than 5 millimeter in diameter, 2 of them 10 millimeter. Criteria 2 اللي هي more than 20 in the within 5 in the proximal rectum, 20 plus with 5 up front. احفظها ب 20 plus with 5 up front. Criteria any plus family history of sessile bulbosus syndrome. دي اقل طريقه ممكن نحفظ بيها لان حاجات كتيره زي ما احنا عارفين وكرايتيريا كتيره، فدي اسهل طريقه. ولكن جت WHO سهلت الموضوع في 2022 وقالت خلتها سيمبل. قالت 5 at least 5 serrated polyp in the proximal sigmoid all have 5 millimeter in size. Criteria 2 more than or equal to 20 serrated polyp of any size distributed through all the colon. Criteria 3 first degree relevant with sessile serrated polyps with at least 1 polyp proximal to the sigmoid colon. Now it's very easy. يبقى 5 5 او اكتر من 20 بوليب all over the colon. ملكش دعوه بقى موجوده في الريكتوم ولا لا. first degree relevant عنده positive family history. لازم حتى لو لقيت في اهله حد عنده بلوبايه واحده in the sigmoid colon is enough to go to sessile serrated bulbosus syndrome. These serrated polyps also include hyperplastic polyp, but it should be large and proximal. أو sessile serrated bulbosus syndrome أو sessile serrated lesion أو traditional serrated adenomas. Next case is 62 years old woman presented for initial screening colonoscopy. He passed medical. His history has significant menopausal hormonal. Sorry, it's the answer. The answer is tobacco use. So this is the next case, which is 47 years old woman who have smoked 30 pack per year and high risk screening colonoscopy because his mother diagnosed as a colorectal cancer at age of 76. At colonoscopy, the bowel preparation is excellent and you reach to the cecum, and while you are withdrawal, you found 6 flat polyp. Mucus capped polyps are removed from the ascending and the transverse colon. Through 3 measuring 13, 16 and 25 millimeter in diameter, the 3 large regions are removed by endoblock by EMR. The pathology report come back saying that this 3 large lesion is hyperplastic polyps, and all the others is sessile serrated polyps. The 3 sessile serrated polyps and others smaller have hyperplastic polyps. يبقى احنا عندنا sessile serrated polyps 3 وعندنا hyperplastic polyps للصغيرين. So what you're going to do for this patient. You will send the patient for genetic testing, or you will say the patient next colonoscopy should be performed in 3 years, or you send it for surgical subtotal colectomy, or you say that your children begin colorectal cancer screening at age of 40. To answer this question, we have to see what is the surveillance of sessile serrated bullosa syndrome. The patient has type 1 serrated bullosa syndrome. So the initial follow-up colonoscopy in 1 year, then next colonoscopy in 2 years. For the family history, the age of start first degree level should have a start for screening colonoscopy at age of 40. 5 years interval is if no finding, and if you found polyps, you can make it shorter, 2 or 3 years as your experience. If you have a sessile serrated polyps more than or equal to 10 millimeter, 3 years surveillance is recommended. The guidelines recommend 5 years surveillance for sessile serrated polyp less than 10 millimeter. 3 years surveillance for sessile serrated polyps with dysplasia or traditional serrated adenoma. 1 year surveillance is recommended for patients with sessile serrated bullosa syndrome. Patient does not meet criteria for sessile serrated bullosa syndrome. If the piecemeal resection was performed, 6 months surveillance is reasonable. Traditional serrated adenoma, it's the least common serrated polyps, hyperplastic sessile serrated or traditional serrated. ده شكل الفكة القشطة تلاقي لما تبص عليها بالاندوسكوبي, high definition endoscopy. So the surveillance should be in 3 years. Tubular adenoma, if advanced lesion, neoplastic more than or equal to 10 millimeter, or multiple adenoma, the next surveillance will be in 3 years. So the answering question is next colonoscopy should be performed in 3 years. شكرا. لو كان الكونتنت عجبكم يا ريت ندوس لايك وشير ونعمل كومنت لو في اي حاجة مقترحات، وبالتوفيق ان شاء الله.